I am.
So here's the thing. Like she said, try not to make it quite as extreme,
Right.
so that you'll do it.
Yeah.
But as you become more accustomed to it, you can just, and it may be like in your first 3 exchanges, you don't even change it. You just do what you can do, and then the next time you do it, maybe, do the first one, kind of start there, and then maybe, you have to figure out how you're going to be able to do it. It's kind of like exercise, right?
Yeah.
You have to figure out what you're going to be able to do.
Right.
But you'll get the best benefits, right, when you're actually doing these things. And I was just thinking, like right now, we're coming into cold and flu season, right? Mm-hmm. This might be a good time to start doing this.
Yeah.
And do this, and that way you could see, maybe last year you got the flu or caught a cold from somebody, and see if this year, you could kind of test and gauge yourself and see if there's some benefit for you here. Okay, now. All right, so you guys do this. Let's get into, because we're already a little bit behind. This is going to be pretty much all practical this evening, so it's going to be a lot of fun. We're going to talk about the heating compress, okay? Now, what is a heating compress? You got this in your book here, right? It is a mild, prolonged, moist heat application to a specific region of the body, generally lasting several hours. I think of, and we're going to talk about this in a minute, but the throat compress, the heating compress that you go around your throat. Has anybody ever used this for a sore throat? Nobody? Really? So I did this as a child before knowing about any of this stuff. And what we would do, well, you could do that. Yeah.
All over the chest, right?
And so with this, you would leave it on all night long, right? So this is why it would be important to have it, to be comfortable, right? So, but this is something that, remember, this is what Vincent Priesnitz did to help with his ribs, right? So let's talk about some of the indications. Well, first one that they have on there is throat, tonsillitis, pharyngitis, laryngitis, earaches, joint pain and inflammation from arthritis. By the way, on inflammation, you realize that when you have a problem, that there's inflammations involved. It's just the two go hand in hand. And so obviously there's inflammation in arthritis, rheumatic fever, for chest colds. So again, this is really good when people are coming around. Another thing this is good for is like a scratchy throat. Now, some of the things that you talked about, you could use those in conjunction with this, right? So you can do the Vicks Vapor. You can gargle with the warm salt water, right? You can do some of these things and add those. This is also good in the abdomen for like constipation, hepatitis, inflammation of the small and large intestines.
Okay, so I have diverticulosis. So
okay.
What would I do? Put the compress?
So yeah, you would run that all the way around your body, and we're not going to do that demonstration, but you can take the demonstration that we're going to do, and you can figure out how you could adapt that, and we should make that pretty easy for you to do. Okay. In fact, I'll go ahead and say right now. So what you would want to do is find something. I'll tell you what you might want to do. Like here's something you could use. Take like a king-size pillowcase. Just take it in the water and just wrap it around you. And then what you're going to do is then you would take a towel and then wrap around you and just go to sleep.
Okay, leave it on.
And just leave it on. Because it's going to do what all these is, and we'll talk about this, but what happens is, yes?
No, go ahead, finish your sentence.
No, go right ahead.
No, I was going to say, the interesting thing that I always find with this specific treatment is that they call it a heating compress. But you don't start with hot water. You actually start like right up there. You start with not cold, but it could be like room temperature.
They say cold. I'm going to read cold here, but I'm going to tell you room temperature is where you start.
Yeah.
You can start right there.
Your body is actually what starts heating up, and that's what makes the heating compress. Your body temperature heats that up.
And in fact, by morning, if you're using something like a pillowcase, it'll probably be dry. Because your body will heat it up and dry it.
Hot. Trust me, it gets hot. Not hot, but it gets heated, let's say.
Now you can use it for the feet, and when you would use it for the feet, you would have the same indications that we talked about, like for the hot foot bath. Remember the abdominal cramps for prostate issues, headaches, and things like that. So you could use this. So this is a nice thing about hydrotherapy, that you can use multiple things. So let's just say that you were having a big struggle here, right? So one of the things you could do is you could do a hot foot bath, right? And then turn right around and then do the heating compress.
Also good then.
So, all right. Now, we don't want to use this if a person's not able to keep their body temperature up. So for someone who's either this sick or like an elderly person, or I'll give you another example. My daughter who didn't have, she had just a little bit of the brainstem and then some of the temporal lobe, but when the brainstem isn't functioning properly, your body can't, that's where your body temperature regulation comes from the brainstem. And so when you have a trauma that would cause an issue there, that you might not be able to keep your temperature up. And the reason is because you could set somebody into pneumonia, right? So we don't want to do that. And it's interesting because Gary and I was talking, like on the contrast shower. He can't really do a contrast shower notwithstanding, somebody who's like actually a physician and people who would know what they're doing, because you don't want to elevate and cause any type of cancer to come up. And you don't want to make this, it doesn't have to be extremely tight. It needs to be snug but not tight, and so you don't need to be uncomfortable or to be stopping the blood flow. All right, so this first picture, we were in Alaska, and I have here, it's called a gator. Any of you guys used a gator? Okay. So this was something that I had used for you, and the one that I actually have was wool, and I've been struggling to try to find them. You can get some. I found some on Amazon that you can get, but you can get just a basic one, and that's what we're going to work with here this evening. And so I got this pack right here for the heating compress, and so I got 3 of them. You got 3 of them, okay? So you know exactly how to use this, right? So this is one right here, and then we would have a. Carin, can I get you to do me a favor? I need while we're doing this, I'm going to need some just tempered water, just enough in there so I can wet that up.
Okay.
And so.
The ones they gave me were thicker. They were thicker.
Well, see, and that would be optimal. Now, because here's the thing, like if you're working with your throat, and this is perfect to go around your throat because that's what it's designed to do, right? And it's stretchy. So what you can do is when you put that on, that way you don't have to use any clips or anything to hold it on, right? You can just simply put it on. So that's just something, they don't talk about that in our manual, but it was just something that in my time and use of this that we've, good evening, Jane and friend, Jane friend. Hi, Lisa. So now my wife's coming up, and we'll do what I want to find out is there anyone in here who would like to have this for a demo this evening?
What about the thing around your throat?
Mm-hmm.
Well, you don't have to do it on your throat. You could
you can do it around your arm.
If it's been bothering you, again, we could do that because of the arthritis, right?
No, to say that, we're going to be also practicing steam inhalation as well here in just a moment.
Wait, we're going to just do around like this?
We could do that, or we could put just around the arm. I mean, you can do that. I mean, and in fact, you could do
You have the blue one. The blue one is actually, I think, the best one.
Yeah, well, that would work, but we also, I could actually put it around the arm, the whole forearm. We could do it, like if you had an elbow issue, we could do that.
I have no issues.
You have no issues. All right.
It'll help you.
God.
Very good.
Yep, God keeps me pretty well healthy.
All right. So, Joanne, you volunteering then right to come help her, right?
If that's what she wants. Cheryl,
By the way, this is so simple. This is just like kind of like falling off a log simple. I mean, but that, you know, there's a verse that tells us that, in fact, it'll be in Karen's charcoal. Are you doing charcoal, Karen? Are you doing your charcoal presentation here?
Wednesday.
So the last verse on there talks about how God uses the simple thing to make foolish the wise things. And that's really what this is, because it's just so simple. Now, we're going to do a throat compress?
Throat compress.
Okay, and we'll leave it on for a few minutes. And what our goal is going to be, it'll be cool, it won't be cold, so you don't have to panic over the cold.
Good. Hit the cold.
But what we're going to do is we'll check back with you in a few minutes,
Okay.
and see if you feel like it's started to warm up yet or not. Okay? And so if you just want to have a seat.
You're going to do the throat?
Yeah.
I would do.
What?
If she doesn't have a throat issue, just do her arm. It'll stick you up.
You still want to do the arm?
I think we should follow the screen.
Okay, follow the screen.
Listen, I want to say this. I want this to be really, really clear on this. These are guidelines. So when I say that, you know, when you're in the real world, you have to figure out how you're going to be able to make things work in the real world. Okay? For what?
No, she's saying to me.
Oh, you're. So all we're simply going to do is just make this just about the width of her throat, and I'm going to hand this to you. And I'm going to let you just simply put it in the water.
My throat hurts.
See? And then see, her throat hurts. Now, you just put the whole thing in there, the whole thing. Yeah, get it all nice and wet. Now, what you're going to do is once you get it down, you're just going to simply wring it out. You don't want it wet and running down their body. You want it just damp.
Is that warm water?
No.
It's not cold though.
Okay.
Depends on whether it's cold or not.
No, it's supposed to be like, you can do cold, but yes, it's, yeah, but you can do, especially because your body's what's heating it up.
No, so if you could take right here, yeah, you want it to be snug, but you just don't want it to be tight. So who would you ask on this?
Debbie.
That's right. So Debbie, how does it feel? Does it feel okay?
That's right.
Feel okay? All right.
Okay. So for this particular one, we could just simply take this, fold it down a time or two. Just fold it down until you just get it just in a nice thing there. I'm letting you do this.
Doing it?
Yeah, I'm letting you. I want you to fold it down. There you go. Well, the only thing you don't want is you just don't want it to be lumpy, because it would over her neck, because we got
Another one?
well I'll explain why.
Dry?
This is dry.
Okay.
Weren't you listening?
Okay, ready?
Yeah, you want to hold your hair probably, Debbie.
Okay.
And you just pull that down and keep it there.
Tuck it in? Or what? Just.
You just have to, its sole purpose is just to keep the moisture
In.
and near your neck.
Okay.
And that's its purpose. I mean, and of course, obviously, so like when you're laying on your bed or whatever, then it'll also help to, keep your pillowcase dry and stuff like that. But it's mainly there. Now, does that feel too tight to you?
Nope, just right.
So could you actually sleep with this at night?
Absolutely.
So
It's good.
if you were developing a sore throat, this would be an awesome way. I did this as a child, not knowing any about hydrotherapy. And so, but this is an actual treatment, and it's that simple. All right, now you can go sit down, and you can go sit down too, Debbie. Or you can stay up with me and you can help me teach the class. All right.
I'll do that.
Okay, here we go. I actually have, so that one's a little bit thicker. I brought this. A very good thing to use for this is like a pillowcase, just something very thin. You just need something just so that you can wrap around on your body, just like so that you can keep it tight. and just something then to go over it. So you can do this without having any pins, but then if you put something over this, you would probably need some type of clip unless it's a circular part of your body where you could use like the skater on it as well. Yes?
This is where I would recommend the safety pin. Just so you know. He doesn't like safety pins. I would recommend the safety pin.
I'm afraid she's going to poke me with them. That's why I like the chip bag clip.
What about using Velcro?
Well, see, that's what
Put that over that, yeah. What it will do is it'll bring the heat in, keep
How about
the
just
thing
using a
on.
Velcro strap?
That'd be good.
Listen, if you have these with a Velcro strap on there, of course you can use it.
A good suggestion, Joanne said, could I use an expandage around it? I said, absolutely.
Yeah, perfect.
Put that on first with the wet thing and then just.
Yeah. In fact, we used to keep that in here because it is a great way to.
Yeah, what happened to that?
That's a good question.
American Express.
Donated it to a church.
That's probably what happened.
Red Cross uses
Sometimes we
What's
do
that?
things, sometimes we don't things.
the red bandage that goes around your arm after you get done giving blood.
Yeah, well, yeah, that's what they're saying. Just you can take that and that way just wrap it around. That's a very good. And in fact, I need to put that back in here because I had forgot about it, just to be honest about it, and we used to use that quite a bit for that. So, all right. So we are going on. I am looking for this right here. Now we're going to talk about doing steam inhalation. Now, no one has done this. I'm surprised. I think you guys probably have because they kind of nodded their head. Have you guys done steam inhalation?
We head over the towel.
Yeah. Anybody else done this? Cheryl, the only? Oh, now we got some hands up, right? So let's talk about steam inhalation for a minute. So what is it? Well, it's just moist air directed toward the mucous members of the upper respiratory tract. It's very interesting. Carin just learned, in fact, just the other day, that she could take a type of steam inhalation would, guess what, be a nebulizer, right? So usually in a nebulizer, you're using albuterol, as for your nebulizer, right? But did you know that you can actually use like 3 to 4 drops of eucalyptus oil in that nebulizer with the water, and it's going to give you almost the same effect, guess what, as the albuterol.
Wow. Yeah.
So, okay. See, well, come, Jane. You can, but see, all right. So Jane has used a lot of these things. This is what I'm talking about. This is something that people used to use, but now we don't use it anymore. It's kind of like it's just. Yeah, because we're looking for something. Yeah, like the neti pot, right? Yeah. No. What did I?
Listen, my grandmother in the rural areas, she would put water in a pot on fire, boil it, and then put
Your essential, yeah.
It just smells exactly like Vicks. And then she will go, she will take it off the fire, she will cover you with a blanket or a bed sheet, and you inhale. By the time you come out of there, you're like.
And that's what we're going to do. And that's what we're going to do. So let's just kind of talk about a couple of things that it's good for. So it's good for nasal and chest congestion, right? It is good for coughs, and I can tell you it was very good. Carin and I, this is one of the main things that we did when we both got COVID. So I mean, because it is really now. They do have a caution in here, and one of the cautions that they have, for the main one is for congestive heart failure, but one of the things they talk about that people with asthma might have some issues. I can tell you that Carin's asthmatic, and she does this, and it's not uncomfortable. So it's a precaution but you would want to know. So if a person was asthmatic, you might want to be, start a little bit more gentle with them, okay? So, yes?
Do not put 8 drops of oregano oil in your water.
No.
I promise you, it's not good. Even if you're not asthmatic.
Yes.
Just so you know.
Yeah.
Maybe 2
that was a mistake that Carin and I made. We wanted to put some essential oils, and we wanted to do a couple of different things. And we did an overdose of oregano oil because, the oil is very concentrate. And yeah, both of us came up hacking and coughing and sputtering, and so yeah, you don't want to use a lot of oregano, but a nice little amount of. In fact, 1 drop of oregano is very good because it's antibacterial, it's antiviral. Tea tree oil is good. There's a lot of different good. Let's see here, peppermint's very good also as well. So you can kind of mix and match some of these things, and just do what you want to do. Here this evening, all I have is the eucalyptus oil. Carin, can you turn on that water for me back there real quick? It's almost pretty much ready anyway.
It's on, that's why I'm back.
So I'm looking for, I know most of you guys, is there anybody here who's not done steam inhalation?
Is that his what?
Steam inhalation. Has anybody not done this? Or would somebody like to try this just as a demonstration, because that's what we're doing? I'm set, we can do 3 people with this. Well, you know what it did to mine. But anyway, we won't. It was very appealing for me, but anyway. All right, come on, Jane. Well, do you want me to bring it to you? Can we follow in the, well, I'll tell you what, you just come up here. I think we only have 1 volunteer for this, so. Peter, you going to volunteer too?
I sit here.
You can sit right there. Carin, we won't need that water back there.
It's already 5:40. Why, you only have 1 volunteer?
I only have 1 volunteer.
Joanne. Come on, Joanne. You said you can do it. Come on.
Let me slide this back here.
That's right. That's right. Look at how healthy you'll be at the end of the week.
Debbie, is it getting warm?
Warm?
Did it get warm?
Is your throat compress?
Is it as cool as it was when you put it on?
It's not as cool.
It takes a while. It's a very gradual process.
But it feels good. It feels very comfortable.
Do you need the water now?
No.
You don't?
Actually, it's just. Now, when we were in Ecuador, we made these very high, almost like a high-tech thing where we took an umbrella and we put these in so that it would bring all of the air in. And so that's one way that you can do this, and it was very effective. When Carin and I first, actually one time when Carin wasn't around and I wanted to do this, I didn't feel like going through all of this, so I just simply put my head over the stove with my tea kettle, and I used the hood vent, and I used the hood vent and put my towel over that, and so it still worked.
Did it?
Okay.
Good vent, like a range vent?
Yes. Yes, ma'am.
Like oven range?
Because I need that one for the other treatment.
Do you, okay.
It does sound hot.
Yeah. That doesn't mean we're getting a warm beverage. I know it's starting to cool off in the fall time here. And I'm just going to simply just take this and I'll sit away from you here. And again, we want to obviously keep, now you can already see the steam coming out. It doesn't take a whole lot. And you don't have to fill the pot all the way up. And so what you can do, because like if you're going to do this for like 10 to 15 minutes, what you could do is simply after about 5 minutes, the steam will start dying down. And then you just put this on and just add just a little bit more.
No, my grandmother believed the more the water, the better. She should feed the whole pot.
Well, you bring your grandmother here. We'll straighten her out. Okay, woo, I can smell that already. Okay, ladies. Now, what would you do? All right, now this is a quiz question. Before you would do a treatment, what would we do?
Ask if you can pray.
Okay, good.
She wasn't even here.
All right, so I'm handing you this. You get to do one. And let's see here. You want to do the second one? Okay. So I'll have you come around to Miss Joanne, and Cheryl's coming around to Jane. They're going to help you. They're going to assist you with this. So they're going to.
Oh, I see. Right? Standing up.
Yeah, you'll be standing on this project.
Okay.
Okay.
Oh, smells so good.
Oh, you're talking about the eucalyptus. I thought, man, I did a good job in the shower today. But anyway, all right. So you guys just have just a short prayer with them, and we'll have them do this for maybe just a couple of minutes and just see if it helps to clear them out. All right. You guys want to pray with the?
Oh, okay.
Yeah, you would pray with your person.
Your patient.
Advantage to Sister Jane. It is an advantage to me, and let it glorify the Lord. We ask in Jesus' name. Amen.
So you can just lean your head. So what she's going to do is very simple. She's going to lean her head over the bowl and just put a towel over her. It's that simple, right?
What is that?
This is eucalyptus. Let's get yourself good and comfortable.
Good job.
Gotta keep that steam.
This is a good picture of Jane.
Who's that masked woman?
Over your head.
I think I got that.
Anything? All right.
Good, thank you.
You okay?
If you're wearing glasses, yes, Robert's got a comment. I know it's not a question, but
Are they supposed
I
to
have
breathe a
this in
certain
there.
way, through the nose, out through the mouth, or something like that?
that would be very good, wouldn't it?
Yes. Yeah.
Breathe in through the nose, right, and exhale.
Through the mouth.
And you know what that'll do? When you're exhaling, it'll actually like push some of that steam in the water. It'll kind of like push that out of the water back into steam.
Inhale, like count to 4, and then let it out for 1, 2, 3, 4. Just like you're working it.
All right, did you hear
How
that?
long?
I did.
Well, she's saying 4. I want to tell you that some of the studies now show to go 8 to 10 seconds. You count to 8 to 10. But you know what? You do listen. If you're,
breathing
that's right. If you're working with an elderly person who can't breathe as long, then you that's the beautiful part of this. It's so adaptable to everyone who's doing this.
Thank you.
I would say that the deeper that the issue is, probably the better results you would be. The longer that you was hold that breath and exhale, because you can get it deeper that way and to breathe deep.
But breathe from the diaphragm.
An
Yes,
umbrella?
that's correct. Yes, that's what they did in Ecuador. But listen, I don't know anybody that's necessary for, you know what I'm saying? Yes, Gary.
I've done the same thing with Vicks Vapor Rub.
And it works, doesn't it? Listen, everyone in this room has tried this. I'm going to tell you, when you go around places, there's a lot of people who've never done this. But listen.
Or your parents would throw you in the shower, the steam.
Listen,
and the steam.
you can do that. That's a good point. When you're in the shower and like the hot water's come down, you can actually just take like your hands in your face so you're not causing yourself to drown, and that steam will catch right in your hands right there, and you can breathe that in.
If you have got eucalyptus leaves, tie them on your shower, whatever, and then run the water and you go under it.
That's what I'm saying. And then you would cup your hands, but leave them like open so the steam can get in, but keeping the water so that you're not inhaling the water. All right. So for you ladies, I mean, did it feel like it opened you up any?
Yes.
Yep.
Okay.
I feel like I'm sweating.
So we could be good with that. I mean, it's really this simple of a process. You see,
Let's go for the skin.
Yes, it is.
Nice.
it makes me beautiful.
It's a beauty treatment. You know, they charge big bucks for this, you know.
Yeah. It's cheaper than going for a facial.
Thank you.
Oh, you're welcome.
Thank you. Thank you.
You're welcome.
Thank you, Sheila.
$50 to $75.
Doesn't that open you up quickly though?
It does.
Yeah, for more than that.
It does. It's like,
Sometimes it's,
during COVID, we did steam inhalation 2 or 3 times a day. With the oregano oil, which is antiviral, the eucalyptus, and tea tree oil. Those were the 3 that we put in
When you had it.
when we had COVID.
yes, Jane.
Isn't this in an herb?
Essential oils, you can use just a bit of Vicks.
Oh, yeah.
Yeah.
Vicks, because it has a
Put a
little Vicks in there if you have the Vicks.
Yes.
How about sea salt? Because, you know.
That'd be great for the nasal, you
Yeah.
know, opening up the nasal passages. Yeah, absolutely.
And bacteria and virus don't like that either.
No, that's true.
That's good. Another thing that you can use, although it's a little bit, these things are all common,
I'll tell you why in a minute.
but wormwood is also good too.
Wormwood.
Yeah. That's-
Who has wormwood at their house?
So,
I'm do.
all right.
You do. Listen, I wanted to say, oh, sorry.
Food for
I
parasites.
think with sea salt, it will sort of dry you up. The oil lubricates. That's the advantage with the oil. It acts as a
Sea salt
center.
garden.
Well, this is what I was going to say. I wouldn't use sea salt, right?
Sea salt
Sea salt
because-
because of the microplastics.
Yes.
This
I
is
would
a-
use like Himalayan paste
this is
because
an
its
herb.
purity level is higher. That's what I'm doing.
This is what I'm
Yeah. You said
I got this in.
I have
So that you can ingest it?
nothing but the.
What's that? So, you're asking a question about ingesting this?
Yeah.
So, with essential oils, you're not really supposed to ingest them, but they can be very helpful. So, if you're going to do that, what you need is you need an oil that's 100% oil, right? But then you use a carrier with it because it's so powerful that it would can burn your throat or whatever. So you can use a carrier and take one of these, but it's not really good to. I'll get it to Carin.
What was the question?
Carrier.
Carrier. Like almond oil or some neutral oil. Yeah, some kind of neutral. The thing is that a lot of times when people talk about essential oils, they're like, oh, you can't ingest them. And you know what? I think that's a safety measure that they say because you can't take an essential oil straight. Okay? But I'm going to tell you, we're going to do some natural remedies. We're going to actually make a cough syrup and we're going to use an essential oil in it. Been doing it for years and years and years and years. And never had a
And nobody's complained, have they?
Nobody has ever, never. And actually it works really well.
But you weren't in,
Died, no, not as long.
but you weren't in New Jersey. It's a whole new beast in New Jersey.
Where's the disclaimer about the essential oils?
Yes, of course, sir.
Okay.
Exactly, well, and the thing is, you're using a few drops with the whole thing, Right. So it's so diluted. But I think those companies like Young Living and doTERRA will tell you, you can't ingest them, but for legality purposes, that's probably why they do that.
Okay. Now we're going to go on to our third one now, which is the Russian steam bath. Right? Now.
Is that the one they put in the cabinet?
Well, you can be put into a cabinet, yeah, so. Okay. No, but what I'm going to do, I'm actually going to talk about, so last night we did a hot foot bath. And when Bobby came up, we wanted the sheet and the blanket to wrap around him snug, right? Mm-hmm. You can use this same platform to do a Russian steam bath if you have nothing else. So you could use like this kettle right here, but what I'm going, or some type of kettle that's creating steam. So in that case, you would probably need like the hot plate or something like, that'll heat that. Now, so what you would do is exactly like we did for the hot foot bath. The difference would be this would go down there, and of course you don't want to have a chair that's going to have metal on it. You want to be very cautious with this, and it's good to have one that's got a dial because it can get very hot very quick in there. So what you would do is you would actually wrap around like an umbrella and you would bring it around to the back of the chair instead of into the front of the chair, and then that way you would have a place that you could sit your pot down underneath the chair. And you would wrap them the same way with the head and the neck piece and leave the head out and have a cool rag. That's the only difference. Now, I brought this as well for us. This is something we got off, I don't know, something for $70. And this is an actual, in fact, it's actually running right now. You can hear it if you listen. And so it's creating steam in here. I don't want us to go into it. You're just going to get all sweaty and stuff for nothing. Well, maybe we'll set Peter in there. But it came with all these pieces. It came with the chair. It came with this pump. The pump comes with a remote, right? So you can operate it. Yeah?
Where did you buy it from?
From Wish.
On Wish. You know, like,
But you can-
it's like
but
the Chinese Amazon.
Is it like Temu?
Yeah,
Chinese
I bet
Amazon.
you could find that on
Yeah.
there. It's the same thing.
Chinese Amazon is Alibaba.
Oh, yeah, that one. What's one of those things? But I think it was Wish.
Get on to it, Peter. So this is really good for people who are needing a detox, okay? So this is very good. So like if you have like any heavy metals, things like that. Yes?
It's 10 up. You wanted to know 10 up?
Oh, okay. So we're right on time then. That'll be perfect. So, but it came with a little floor mat. It even came with, check this out. Now this is all included in what we got. We got a little chair that you could sit in here. And it has the little steamer. Can you see the little steamer inside? Careful now.
Joanne was saying she didn't want to sit in it, and I said, Ron doesn't sit in it. I'm just making that.
So when you put it together, your head would stick out here, and then your arms could either stick out or stay in, one of the two. And then you just zip that up. And it actually has a timer on it, so you can set it in for like 15, 20 minutes, whatever you want to do. And then when you do, but I want to caution you on this because it has multiple levels for the heating. But it's the same as here. You have to make sure, because what this does, well, actually, instead of lowering your blood pressure, this will actually increase your blood pressure. So if our friend Cheryl, if your blood pressure was actually a hair low, then this was something that you could actually do to help to increase your blood pressure. But I went and I did some, because when I'm talking about blood pressure, you know, you typically when your blood pressure is low, if there's not an issue of like being woozy or something like that, that it's okay, even if it's, you know, a hair. Actually, because it's typically for those who are, guess what, in better health. So my thought for Cheryl was, well, she's just in better health than the rest of us. So, but anyway, so that's kind of on this Russian steam bath. Yes, Robert.
What do you do when you come out of that? Is there something special you should do?
Well, that depends on what you're doing, but I will tell you, like when we were in Alaska, we ran out and got in the snow, but we did that like a contrast. So that was like 3 minutes in and go out for 30 seconds and then come back in again. So you can do something like that. You can do it for a period of time, you know, like 15 minutes or something like that, and you're going to get what?
No,
Well, I thought you was giving me a hand signal of some sort.
I didn't say that. Rest is really
Would that be like the
Okay.
Scandinavians
Yeah.
who go in like the sauna and they're in there for X number
Yeah.
of time and then now jump in the river?
Right, it's the same principle. And so getting back to your question, and Carin was mentioning this, and that's where I was going to wrap this up with, but you would need to go lay down and rest probably. And that's also a good time when you've done this. Again, all of these, and I keep going back to this, like this might be a really good time for a massage, right? While you're resting right there. See, stress, now listen, without a show of hands, I'm pretty sure that nobody in this room deals with any stress. Oh, there is some stress here, okay. There's stress, everybody deals with stress. And stress affects every disease that we have in a negative way. It makes it worse. And so these types of things like this is very good for stress. Massage is very good for stress. So when you're doing these and then you're resting after this, it really, you kind of like resets your body so that you can handle a lot more. Yes?
So would you do this more than once a day, or what's the?
I don't, well, if you're doing an exchange, I don't think that I would. If you were actually treating, so it really depends on what you're doing. If you're trying to detox heavy metals, you may want to try to do it a little bit more. But for just coming in and trying to de-stress or something like that, because this is fairly intense, especially if you got the cooker on going pretty good. You know, because it'll steam you up. I mean, out of now until you get into like the fever baths and things like this that Carin's talking about, this is very draining. Yeah, the others are not near as draining, in my opinion, as this is, because it's more intense. So the more intense therapy treatment that you're doing, The hot foot bath, if we, instead of using the two items that we did, which was the sheet and the blanket, if we use the sheet, a blanket, and a piece of plastic to hold that heat in, you're going to be doing a higher level of treatment. So if you're doing that, then you're going to, it's going to be more effective on you and drain you more as well. Because your body, you're moving these white blood cells around, right? And your body's trying to start fighting. And what happens, this is a very simple way to illustrate this. What happens when you catch the flu? What do you want to do? Rest. Because that's your body, when you rest, it's when your body, it's when it actually does its restorative process. So that's what you're doing. You're actually doing part of that restoration then. Good question. Any other questions or comments on these?
So Russian steam bath and then come out and do a polar bear plunge.
That's right. And that's easy to do here, right?
Yeah, not quite.
I imagine if you're in there and then you need a break and you just open it up, it's gonna feel cold.
Well, it will feel cold, but it's only,
I know it's not the same.
but it's not the same. You really you need to get out and so,
Prior contract.
see, and you missed because I was talking about, I was in Alaska and I was doing one of these in a room, and then we ran out into the snow and spent some time, and then would run back in because the snow's really cold and you don't want to stay there very long. But then when you start heating up, that snow, you're looking forward to getting to that snow when it's really hot.
I was listening to the previous, was it yesterday? When you were talking about that, I was listening to it in the
Oh, okay, so.
tonight. When I was on my way to pick up Jane.
Now, how's this now? Is it still cool?
You know what? I put my fingers down here. It's really warm. Really, really warm.
Now, and that's where you want, and it's going to go up to your body temperature and stay at that. And because it just that little bit of coolness is all that needs to start that response system from your body. Yes.
It feels really good.
So what is the science of that? It's pulling out, like if you have a sore, this is for a sore throat.
Yeah.
So it's just pulling the.
So what we're doing when we're doing a contrast, so this isn't going to be a contrast, right? When you have hot and cold opposing, what it does is it changes the circulation, increases that circulation. The circulation then comes to where you're being worked on. So if it was on her arm, the circulation is going to be, everything's coming to here. So you're going to get your lysosomes and you're going to get your white blood cells all working in this area, along with that circulation. Now, as Peter was pointing out last night, I think it was you, that when we get this circulation, some of the things that the blood is doing, number one, it's moving the oxygen around in your body. It's sending the food and the nutrients to your body. But not only that, it's also getting rid of the waste in your body as well. That's why the circulation, the whole circulatory system needs to not be blocked and stopped. It needs to be moving everywhere. Listen, as for an example, do you want your brain going without oxygen? Because how long are we going to make if our brain's not getting oxygen? It's a very short amount of time. So we need to have this circulation all through the body, and of course, especially in the brain. Which is interesting because guess what? 80 to 90% of all disease starts right here. Yes?
So I was just curious, I know about the contrast because 3 minutes, by the time 3 minutes is over, like it's hot, then you need the cold to kick it back. Put the blood back in motion to start the circulation again.
Well, the cold's going to slow it down. The hot speeds it up, and then the cold slows it down.
Okay, I thought that.
And you want to end on cold. Now, what was your question? I interrupted in the middle.
Different way. So with this, how long would you leave it on?
This is good for all night long. The cool was very short-lived, but it was a gradual change.
Right, so I told my daughter, she's in California, and she had a terrible sore throat. And I told her what to do, and she left it on all night. And she said, just took the sore throat away. By the next morning, it worked.
Yeah, we did that with my son. That was one of the stories I was telling. So yeah, I mean, and it works very well. And I like that gator idea because that way you don't have to, because in our book, you'll see it, they're showing the pins and stuff. I like that much better than the pins. Yes, Joe. It's Joe, right?
Yes. You can use onions as well to do just
Sure.
that. Like a poultice.
Exactly.
And babies, no. But adults, yes. Because for instance, you can wrap it around a child's foot or under their feet, but it's sweat, but it burns. So I wouldn't advise.
So Carin has that's a whole nother category. That's not a part of what we're teaching here, but it is very effective. And when we were in Ecuador, there was a physician. No, we were in Ecuador. No, we were in Brazil. Sorry.
We're somewhere.
And there's this lady from, well, her and her friend, are they from Peru, Bolivia? Where was she from? Dr. Carin.
Oh, she was from Paraguay.
Anyway, she's from Paraguay, right? And she starts getting this earache, and I'm like, Carin had an earache, and she did this, so we're going to try it. So it's this onion that you're talking about, but like you said, it's very strong. So what we did was we just simply took this towel right here, a little washcloth, I don't know where it's at now, and we just simply we heated the onion, cut it in half, put it on a little hot plate, heated it up for about 5 minutes or so, and just wrapped it up in this, and she just held it near her ear, and the earache was gone. So the onions are really good. Here's my thought though on this. In many cases, and this is why this class is important, is because guess what? More than likely you got water before you have an onion. Most people here in the United States are going to have an onion in the house, right? But you don't always have an onion. Maybe you haven't went to the store and got them, but your water tap's still working. So that's one of the reasons that I would go with water always first. Yes?
Sure. When I was in India, though, interestingly enough, that's what triggered my asthma right away. We did onion poultices on my chest every night to go to bed because it was the only way that kept me breathing, because I had no way to seek any kind of medical thing. So that's how. There
are a lot of vegetables that you can use for these things, for poultices. Onion is very good because guess what it does? It pulls bacteria. That's why you can't leave one open in the refrigerator and then eat it, because it's got the bacteria in it.
Well, that's another.
Yes.
No, I'm just saying, in a child's room, you just cut it in half and leave it in the room overnight.
Yes.
Yeah, it's very good for that, yes.
So you want to know why the earache, why that onion worked? Actually, the onion pulled the fluid away from the inner eardrum and took away the pain. Because obviously when you have like an earache, some kind of inner earache or middle earache, there's fluid pressing onto the eardrum, which is painful. But the onion right away, when we did that for myself, I had the same problem, and we cut an onion, threw it in the oven at 400 for like 10 minutes, put it in the washcloth, and I literally, because I was having those sharp stabbing pains like every 30 seconds, and I had to speak that afternoon, and I said, I cannot concentrate. How would I ever go up there and with every 30 seconds my pain is like an ice pick in my ear. And we prayed, we put the onion there, the pain went away immediately. Immediately. So if you know children or grandchildren, just talking about onion poultices and stuff, just that heated onion for kids with earaches, because earaches are always I was a child that got a lot of earaches. It works like a charm. So and it's simple. Well, since I'm going to be starting, I'm just going to, if we could bow our heads really quickly just for a short word of prayer. Heavenly Father, as always, we thank you so much, Lord, for these simple treatments, Lord, that have been life-saving for many people. And so we ask you, Lord, to please bless us with these, that not only can we apply them in our own lives, but we can also share with others, Lord, as you would do in touching lives for the kingdom. In Jesus' name we pray. Amen. All right, so we're just going to do just a short little review. Of course, we know that pure water is vital for a healthy immune system, isn't it? It's a detoxifier. It flushes the germs out. It also gets all the pollutants out of the body. So water is essential, right? In fact, the bloodstream, which is the highway that transports our immune system, it just keeps flowing freely just by having enough water. Ron, when he talked about hydrotherapy, talked about, that we are approximately, 70% water, Ron? 65 to 70%? 65 to 70% water. So we need things going. So we know, even like we were talking about with headaches, or even like memory loss, if you drop your water volume in your body by 2%, it can cause memory loss. So sometimes we need to make sure we're drinking enough water, right? But also the mucous membranes, these things that we have of the nose, the mouth, things like that, they need water because they are the protective barrier. They are what are protecting us from getting a lot of those germs and things like that. Now, we can't always, all the invading germs, we can't always, just by having enough water, but we can certainly really build up our immune system by protecting ourselves that way. But we're going to go back and talk a little bit again about the 1918 Spanish flu. Ron mentioned that, and for those who weren't here, that night that Ron talked about, it was yesterday, right, Ron? You talked about it. That in that pandemic, there was a treatment that was done at 2 hospitals in the United States, Loma Linda University and Washington Adventist Hospital. These 2 hospitals, when people had the Spanish flu and came to the hospital, they did this treatment, okay? And it is called fomentations, okay? So we're going to talk a little bit about what fomentations would be. We're going to do a demonstration today. I'm actually going to show you a video because I think she does such an excellent job at, preparing people, to understand how to do fomentations. So if you're looking in I don't know what page, anybody have that on the page in case you're going? 35. Okay. This, again, before I show you and talk a little bit, just want to let you know that this is the treatment that Ron did for me during COVID. Because, again, the concern about my asthma was high, and I was at a very low. I was at 91. I went down as low as 89, but my oxygen saturation went up, a little bit. So we, low 90s, but we kept doing the treatments because it wasn't that I was in a dangerous situation, but I was very low. So I was getting to where it was kind of borderline. But Ron was diligent in doing the fomentations with me. So we did this at least once or twice a day to do that. And because I also knew, of course, about the history of the Spanish flu. And I'll tell you, I did not have one asthma attack during my COVID, not one asthma attack. All right, so why does the application of a fomentation. Now, a fomentation is basically a hot pack, okay? And that's what we are going to be doing. And we're going to be showing you a demonstration. This is called the general revulsive to the chest, okay? This is what we would do for mostly a respiratory situation. So why does this hot pack work on the chest? Well, right here it says, the application of heat to the skin draws the blood to the surface and away from all the internal organs. The heat relaxes the muscles and decreases pain and inflammation. What happens then is it increases the blood flow to the area and stimulates the white blood cells. So that's what we're doing when we're doing the cold portion. We're stimulating those white blood cells. The sweating part, though, actually causes the heat, increases the body's ability to eliminate wastes and toxins in the system. So the treatment calms and soothes the nerves. Now, this is something interesting. Ron mentioned when you're sick and you have the flu, you just want to rest. But hand in hand with the flu goes what? Fever, right? This is how our body's response. It brings up a hot temperature. Why? Because it needs to eliminate the wastes. It needs to break that, in our body. So what we're doing here is we're applying heat. That is why when we're doing the the hot foot bath, when we're doing the steam inhalation, when we're doing the Russian steam bath, what we're doing is we're bringing heat to the body to get rid of those pollutants, to get rid of those viruses, to get rid of those things out of our body. Now, what would be the fomentations or the general revulsive that we're going to be do? What are they used for? Well, chest congestion, cold and flu, bronchitis, pneumonia, asthma, pleurisy. These are reasons why we would do these hot packs. They heal and improve the function of the internal organs. It helps with neuralgia. It's helpful with painful muscles and joints due to a back injury or arthritis. And people difficulty sleeping. You can use these hot packs to do that. How about nervousness? Sometimes people have anxiety and nervousness. You can actually apply mild heat to the spine, which will help reduce the nervousness. It helps detoxify the liver and the kidneys. You can put these fomentations right on. Now, like I said, we're doing one for the chest, but you can put these fomentations in other areas of the body. And then it can also help warm a body part in preparation if you were doing another type of treatment that the body needed to be already stimulated and warmed. Now, you would not do a fomentation on somebody if there is bleeding or hemorrhaging, okay? Obviously, that's going to draw the blood to that area. We don't want to have this, exacerbation of bleeding, right? Now, what are some things to be careful for? Well, we want to not make sure we don't burn somebody who is paralyzed. If you're doing this, they have no feeling. You don't know if this is too hot. Because you see in this treatment, and you'll see in the video, sometimes you'll get a hot spot because we are going to be using a heavy-duty steam, and I'm going to show you. We'll show you that, and then we'll, we're going to do a demo here today, but we are not going to do obviously a full demo because this is a treatment that you would definitely need to rest. And another thing too is in this treatment, just so you know, that more than likely you would be down to a lot less clothes, okay? Just maybe undergarments. And the reason why is because you need to make sure that area, the chest area is exposed, is the one that I'm going to show you. The reason why I'm going to show you the general revulsive to the chest is because I think, especially when we talk about these respiratory viruses and things of that nature that are floating around all over the place, and especially since that cropped up in 2020 for us, COVID-19, I think this is going to be the treatment. For those of you who were here yesterday and I shared the story, did you guys see yesterday's program, Lisa? Did you guys see yesterday? Did you hear me tell the story about the person in the hospital? No, Ron told it. I didn't.
I didn't get to it yet.
You didn't get to that? You heard it. So real quick, remember that somebody called me to find out how to do this treatment because their husband had COVID. They ended up on a ventilator. In the hospital, they told her to make arrangements. He wasn't going to live. And she was in the hospital because this hospital happened to allow her to stay because she happened to have COVID when he did. So they said, you can stay and be with him. We think it's important to support the person you love. Be there for them. So anyway, she had a little rice cooker, a little hot pot. And so she boiled water, she got ice, and she did I sent her how to do the treatment. She did the treatment in the hospital. That next day, his vitals went up. And like 2 days later, he was off the ventilator and is alive today, okay? So by God's grace, of course, prayer was involved first and foremost because we know God performed the miracle. But what a testimony. I don't ever Ron never does a hydro class, or we don't talk about this without ever telling that story because that's how powerful hydrotherapy can be. All right, so, also be careful about, did I go over all these? Okay, somebody has edema, like, where they're retaining water. Don't do this treatment. This too, bringing that hot there is not a good idea. If somebody is diabetic, you need to be careful about that. You know what I mean? Making sure that they are not, the body part that you're going to be doing the fomentation on, that they don't have any nerve damage or anything, because these fomentations can get very hot, okay? Somebody has neuropathy, that's, usually goes along a lot of times with that nerve damage with diabetes. somebody has loss or feeling, if they have numbness or decreased blood flow to like their legs or feet, their circulation is bad, you really need to be careful because they're not going to feel it. You could actually harm them a bit. Body areas where the bone lies close to the skin. You need to be careful with that. You want to make sure that this is mostly on muscle. You know what I mean? That's what we're looking to do. If it is on that area, you need to make sure you have some extra padding because you could definitely burn somebody because the muscle is obviously going to keep you, a little bit protected onto those areas. Avoid chilling. You need to make sure that this is a treatment that you want to do the hot, then the cold, then they get the hot back on. You cannot be in like a room that has any kind of fan going on or anything. You don't want to chill that body, okay? And also, be careful not to spread an infection. Make sure you're cleaning your equipment and everything carefully. Obviously, if somebody's very sick, don't, if everybody says, oh, I don't feel good either, don't slap them on there too. Make sure everything's cleaned good. Only because, again, we can actually, spread germs that way. But anyway, what I'm going to do, and I don't know if you guys can see pretty well there. You don't need the lights off or anything, do you, to see a video? This is a video done by, her name is Lisa Meisner, and Lisa Meisner works with a ministry called Sustainable Preparedness. Okay, now they do like these. They do a whole course on preparedness, but she does a great job with this video. So I'm going to let this go.
Large piece of plastic over your bed or table. If you don't have a large piece of plastic, place your warm water. Layered pad that's been sewn together, and it retains heat very well. Once it's heated, you would fold it inside of a fomentation cover. The fomentation cover is actually a wool blanket that's been cut to fit around the pad very easily. If you don't have a fomentation pad or cover, you can also
trying not to go in front of the camera. So you can see that there's a little bit of more of a complex treatment, and it uses multiple treatments. What 3 treatments do you think that we use here in this general revulsive? The hot foot bath, right? You're doing the fomentations, and this is called cold mitten friction. Okay, cold mitten friction is when they're cooling down, and then, like she had said, after the patient is done, they should actually you should either do a cold mitten friction on them. Like when I was sick, going in to take a cool shower was not an option because I was like, I could barely stand up. I was like very weak. So Ron just had to take the cold towel and do my body and do that circulation like that. So she did a great job though, doesn't she do a nice job to really make it very, simple but very understandable. But I'm going to tell you this treatment is the treatment, like I said, that saved thousands upon thousands of lives during the Spanish flu. And you wonder why. When the government studied this, why did we not do this during COVID? Why weren't hospitals using this treatment when it was effective so many years ago? Yes?
I don't think the pharmaceutical companies could make any money on that.
Of course not, because really, how are they going to make any money on water and towels? They're in the wrong business for that, right? Yeah, laundry business. Cheryl said they could be in the laundry business. But the only way that they could make a couple dollars. No, seriously, and that's probably, if you think about it. But if we think about, the simple treatments, using the water, using onions, using all these things that we've learned so far as we are going through, can be life-saving. I mean, this is life-saving, folks. I want to say that with God's intervention, with all the things, and Ron and I were diligent in following every law of health we possibly could, and taking good information about the proper supplements to take during that acute issue we were having. I mean, honestly, I could have been in a whole different position with my health during COVID. And yet in 8 days, I was fine, And so, again, everybody has a different, level of, immune system, recovery and all of that. But it could have, I had a complicating situation with my asthma. So anyway, so I'd like to see if anybody wants to go through. Now, we're not going to do, like I said, a real, general revulsive. But if you'd like to, we can have a volunteer to be the patient, and we can have somebody, and I can talk you through the steps to doing this. Only because if you don't do it, you won't remember it, I mean, she did a great job, but I bet you tomorrow if I ask you what are the steps you'll get some of them, but will you remember everything? It's hard for me to remember sometimes. By the way, graduating in a medical missionary program, our final exam, we had a lot on our written test, but our final exam was to do the general revulsive because it's complicated to keep it, and you have to keep that thing flowing. You know what I mean? When they're under there, you're getting that other fomentation. You're coming back, you're doing this, you got to get that. You got to get the other one back in the thing. So yeah, Ron was back and forth in the kitchen, the poor thing. But what we did, just so you know, we didn't have any fomentations. I had them, but I didn't have them at my house. You know what I mean? So, I have some, these are just some old ones that we have for demonstration. Here, I can pass these around if you want to see what they're like. These are all handmade. Like, you can't buy these fomentations anywhere. However, guess what I found? We can pass that on the side. No, you know what now? Oh, that was a good idea. But listen, you want it because you want it to maybe something that's going to hold the heat in. Do you want to know what I found? Because after COVID, I said, I want to be prepared in case this happens again. And towels are good, but I want the best thing possible. You can pass that around if you want. You want to know what I did? I went online and I kept looking and I found pads very similar to this, from people that buy them for physical therapy. Do you ever see in the physical therapists, they have like those big steamers where if you've ever had physical therapy, a lot of times they'll be using like a hot fomentation. And so I found them online very inexpensive. Now they're not as big as these, they're not as, probably, I don't know if they hold the heat as well, maybe they do, I don't know. But I bought them because they were cheap. They were like $8 a piece, and they're a little smaller than that. But for $8, I bought a bunch of them, and I have them. So now poor Ron doesn't have to use the towel method, And you know what I'm going to do, and I haven't done it yet, but I'm going to just buy an army blanket at the Army Navy store, right? And just cut it out. Oh yeah, we have plenty of those. Trust me, we've moved a couple times. So we have those. Cheryl was suggesting maybe the moving blankets. So yep. So anyway, so does anybody want to go through and do the general revulsive? Do you want to do it? You'll be the treat being treated, or will you be the treator? She wants to. So anybody want to lay down and let Lisa do the general revulsive on them?
I'll lay down.
Up, Cheryl lay. Cheryl is willing to be the patient. She'll be the guinea pig. So.
The cold water.
Oh yeah. So anyway, and I'll walk you through it. Lisa, you might.
After they heat the cold water, actually feels really good.
Yeah, because let me get this here. All right, well, look at this out. I have here, in case you wanted to we didn't put any plastic down. This is, just a sheet underneath, but she had plastic underneath it. At home, we didn't put any plastic, but we did use a towel. So I'm just going to get Lisa's towels ready for her. And, yeah, might as well. That would be easier, I think. Just sit up there. All right, so the first thing she's going to do what is the first step to this general revulsive hydrotherapy treatment? Prayer. What? Pray.
Somebody start boiling the water.
So prayer is the key. So before that, well, you know what? First of all, let's move the blanket out because you're going to be under the blanket, remember. But before that, so I would suggest, yes, hon?
Just do it on top of the blanket. That way you can just...
Oh, okay. That's a good idea. Sorry, Cheryl. Make you get back on there. So so you can see what she's doing. If we put you under the blanket, it'll be a little bit inhibited to a thing. So you can go ahead and do it. So you guys have prayed, because we're not doing real treatment and you don't necessarily have to pray. But then you're going to start with what?
The foot bath.
Very good. So Lisa's got that foot bath going. So you can pretend you can put a towel down here. Let me get you a towel for the foot bath. Oh wait, before that too, remember she had the towel and the fomentation on the back. So we're going to put this here, Lisa. And you're going to need a fomentation pad. Now remember, this is usually going to be kind of hot. We're going to just put it under a towel, okay? But normally, to keep the heat in, something wool, like a wool blanket. That's why I want to get an army blanket. And I was going to buy one on Amazon, but I was like, they're a little pricey. So I thought maybe, isn't there an Army Navy store in like Seaside or something? There used to be, right? Maybe they have blankets there.
Beach too.
There's one in Bradley? Huh? On the base, yeah. Can I have one of your blankets, please? Anyway, so go ahead and you can put the fomentation right in here. Pretend that we have the cover on it. And then that was going to, now this is going to go right on the spine, remember, because this is going to now, it could get warm. So
Should this be?
I would go all the way this way.
Inside.
So yeah, it's an in triplicate, okay? So you could actually put it in the second layer. That's right. You could put it in the second layer and have two there, because you don't want to burn the person. And trust me, this thing stays pretty warm. So we'll put that.
On top with 3 layers underneath?
You know what? We don't have a cover, so we're just going to use the towel. But yes, you just put the towel down, you put the fomentation, and the fomentation is usually covered, okay? So we're just saying, here you go, here's a towel.
So you have towel, fomentation towel?
Yes. But we're going to use, we only have 4 towels, so I want to make sure she has enough towels. So she's got the fomentation. Okay, Cheryl, jump on up. Don't jump. All right, now Lisa's going to do the foot bath. So, did you test the water to make sure it was okay?
Oh, yeah, I have to toe it. It's good.
Okay, Cheryl said it's fine.
It's good. That's good.
All right. So, and again, remember, normally now at this point, Cheryl's going to be covered with the on the bottom, and then she's going to have the towel or the thing. Now, she wouldn't have a shirt on because remember, we need to make sure that we're getting this temperature contrast as onto the body like that. So normally Cheryl wouldn't have a shirt on here, so she'd be covered under the blanket, and of course, for modesty, we'd keep her under the blanket. So,
Do you put a towel?
no, the blanket would be over there, so you'd be fine. Now there would be a towel underneath there. Actually, there's a towel underneath.
Okay.
We forgot about that. And the reason why is because when Cheryl's done with her treatment, you're going to want to pour the cold water and you want a towel accessible to get her feet dried off. All right, so there you go, Cheryl. Feet are in. All right, you're looking good so far. All right, Lisa, do you remember now what our next thing is?
A sheet?
Actually, no. You're going to have another towel. The towel is going to be on Cheryl's chest.
Her chest.
Yes. So Cheryl, then you would have a fomentation, and I would put a fomentation then in. I would put it inside this one because we don't have a cover for it. Like I said, I keep saying I'm going to get one. Yeah, you could do that right there. And again, you leave it in triplicate. And usually it would be covered already. And then the fomentation sometimes is, you could just put it on top of there, that would be fine. Sometimes the fomentation, this towel is kind of nice because it's wide enough, but sometimes the fomentations hang over, just fold them over.
Oh, yeah. So it doesn't burn.
That's right, you don't want them to burn, you don't want their arms to be burned. All right, so now, you could put it on. There you go. So Cheryl now has her hot fomentation. Robert has a question.
So you don't put the fomentation on top of that first towel and then see if she can handle that?
No, you need those layers. In fact, sometimes you're going to need more layers.
Because the girl was swapping out that top one for the cold one.
Yeah, well, you're going to when you take off the fomentation, she takes off the top towel and the fomentation and leaves the bottom towel to swap.
Oh, you swap it?
Yeah, and that is really just because of a modesty thing. Okay, so, and of course, you know, she wants to make sure when she's doing the cold. So you're going to see, it's going to be number 1, to protect. Number 2, to modestly switch the towels because, you know, again, we want to make sure that it's in a modest situation. Well, Cheryl, if your 3 minutes are up, so Lisa's going to now switch this out. So Lisa, you're going to take the top fomentation off and the top towel off. Okay, and you're going to leave. All right, and you're going to leave that one there. Now, do you remember how to switch this? She thinks she could do it. Yeah, oh, she got it. Right, so what happens is she's going to take that and nope, you're just going to, nope. You made her naked on your side.
I made her naked.
Sorry, Cheryl was naked. All right, let's start it again. I'll show you a really quick, easy way. Okay. So you're going to take the corners, you take it here, and what you do is you just roll it over, and then you pull this one out, okay? And then this is now the cold one. So what she would do is, you can just mock demonstrate, mock demonstrate. She would go around, and obviously women have breasts, so you would go around that area. Make sure that you get that. Again, this is a 30-second. But one of the key things I want to mention is when Cheryl was laying here with the hot fomentation, now we're just speeding through this because we only have 5 more minutes. But we were speeding through this and it's a mock demonstration. Number 1, we're not doing a real demonstration because of the rest factor that you need to do. But the second thing is that when Cheryl was laying here, you would have been going to get that next fomentation. You need to have it ready. Okay, so then you did your thing. Now what you need to do is now you'll switch those towels. So let's make sure it's in a triplicate again. Let's see if you can do that.
See if I can do it.
She can do it. I know she can. Roll it over. And ta-da, she got it. There you go, and she got it. And now Cheryl's, again, modestly covered, and she would get her hot fomentation. She would put it on again, put the towel on top. Again, if you have hot spots, that's what we have. These little, washcloths, you can put them underneath. You can put a few sometimes. Let me tell you something, it's interesting, because Ron, from the same pot of water Ron was doing, the first one would be fine, I'd have no problem. The second one, I would be like, it's hot here, it's hot here. It's like, you don't need, and then the next one would have hot spots other places. It's just very weird. Remember, the key is to make sure Cheryl's hydrated. Cheryl, you thirsty?
I'm thirsty.
She's thirsty. Num, 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 num. Okay, and also, how is Cheryl sweating? Maybe she's hot. What would you be doing?
Taking a cool cloth.
That's cool cloth. So she's got that cold water. She'd be putting that on her thing. So now we're finished with the treatment. Okay, you've done your cold mitten friction. If you want to switch it again, you can. But say you just did it already. She's covered with the towel again. What are you going to do?
Now I'm going to get
the bucket of
water.
Bucket of cold water.
And another cloth, or?
Well, you have that right there. You can use that one.
Okay.
And so you're going to get Cheryl's feet out of there. Cheryl, if you could put your feet up, okay. And if you
flex your feet.
Flex your feet up. Yeah, if you can keep them.
Then,
she's going to pour that water. See, it's very cold. But it feels good, right, Cheryl?
No.
All right, don't put your feet back in the hot thing, because Lisa's going to take that out. You're going to put your feet down on the towel. And Lisa's going to wipe her feet off and dry them up. Now, the next thing is that she can lay there for a few moments, and then the suggestion is to either do a cold shower, or if she wasn't able, like I was, then I wasn't, then you would do the cold mitten friction all over the body. Robert.
How do you get rid of that towel?
Well, she's underneath it. Of course, when in the end, Lisa can step out and she can get dressed. Yeah, she can get dressed. You could wear a bathing suit. You just want to make sure that you can do the friction on the thing.
The chest.
Sure, the chest, because we remember this is where we are stimulating the white blood cells, getting that, because now the body has been relaxed and soothed. Now it needs to. It's almost like the cold will indicate to the body and the white blood cells, an emergency, what is that, what's the matter? And that is why they all go over there. And that's why the contrast works, because now it's stimulating those white blood cells and those lysosomes. So anyway, any questions?
So once you've done the cold shower afterwards,
Then it's nighty-night.
they should be dry, right? Once you go to lay them down?
Oh yeah, well, so after she showers, she would dry off, and then she would lay down and rest for, at least 20 minutes or so to a half hour.
Along with the shower head.
You could just, I would say, I don't even know the number on that. I'm going to say, even it's a quick one, because it's just getting that, again, the end on the cold note. So anyway, it wouldn't be like, it's not 5 minutes, but it's not 5 seconds. You know what I mean? You want to get that as cold as possible. So you can see that this is a little more complex, because you got to keep going back and forth. You want to do this 3 to 5 to 6 times. We were doing it, 4 or 5 times every time, and doing it a couple times a day. But Ron got really good at it, by the way. He was like back and forth, back and forth, back and forth. Yes, he got here. Anyway, any other questions? All right, before Cheryl falls asleep, let's have a word of prayer to close tonight. Heavenly Father, again, Lord, we're so thankful and blessed, Lord, to be here, and we're looking forward to tomorrow and the things we can learn about nutrition. We ask you, Lord, to please bless us in a special way, in Jesus, and keep everybody, Lord, safe on the ride home, especially with this weather. In Jesus' name we pray. Amen. Tomorrow is the cooking school. Don't miss that. You guys have been sitting. What?
Oh, thank you.
Cheryl's fine. She's good. All right. So tomorrow's a cooking school. We'll be doing some delicious, simple, nutritious, and delicious recipes. I hope you enjoy them. There's always samples involved. So samples tomorrow. So come with a little bit of an appetite, and we will enjoy some nice plant-based cooking.